Hey everybody, Dr. Scott Schreiber with Minnesota Spine and Sport, and today I'm going to show you a mobility routine that you can do while you're working. I recommend doing this 3 times a day. Again, this will help you get out of your desk and out of those sustained postures, maintain that mobility, and keep away that pain. So first thing you need to do, again, I have a mat. You don't necessarily need it or not. You get in the quadruped or on all fours, and you just start doing these, we call cat camel in the rehab world. So just up and down. This helps mobilize and limber up the back. And you're gonna do this in 3 directions. So we're gonna start flexion extension here. Next one is we call lateral flexion or side bending. So just back and forth like this. Nice and easy. And then, last but not least, we're going to do rotation. This comes up here. Just bring your arm down and up like this. Just so you know, doing these nice and easy. We're not looking for any, really straining or anything like that. And you shouldn't have pain when you're doing this. Just nice, easy mobility exercises, keeping things moving. You should feel the same on the left and the right. If you don't, that may be a sign that we're having some dysfunctional areas, and that would prompt you to give us a call or whomever you see, just to get that checked out, just to make sure left to right you're even. Another one again is you can go back into this child's pose yoga style here. Again, stretching out all this area. And then you can turn to the right here and then back to the left. Next, I'm going to go up on all fours. Really easy. Again, we're going to stretch these hip flexors, and then we're going to stretch this hamstring. So first things first, lean in here. You're going to feel a squeeze in the cheek, stretch this out here, and then start to lean back. Stretch backwards. Again, if you want, you can do it like this and like this. Just back and forth. Nice and loose. Make sure you do both sides. Big thing here, that from sitting all day long, hip flexors and hamstrings get real tight. When the hamstrings get super tight, that limits hip flexion. So what happens then, the next available spot is your back for flexion, and we start having lower back issues. So now we're going to have you on in a push-up position. Down here to do press up, all the way up, all the way down. Nice and easy. Good. After that, we'll have you stand up. What's called Brugger's relief position. Hands out here, bend, and open on up. Notice how my hands are down and back, retracting, pulling in my shoulder blades. You don't want this. Nice and relaxed, squeezing them together. Watch your head going forward, make sure it stays back, just like so. So you can see from the side, just like so. Patients tend to forget this part, real important, especially stretching all those wrists from typing all day long. Okay, so last but not least, we're gonna hit just some nice squats here, real easy. Again, just you come down and back up and down. Just get some movement, hips, knees, thighs, core. Good, perfect. That's it. That'll take you a couple of minutes, and again, and you can go from there. You can add in if you feel there's other little mobility exercises you like to do. It's totally fine. But the whole idea is at 3 times a day, get these things going, and that's going to help you out big time as far as pain and really eliminating the mobility issues that you have from chronic desk posture. So if you need anything, feel free to reach out. Talk to you soon. Dr. Scott Schreiber.